We can't separate health from social services. I mean, the two of them really need to be strongly together, need to be strongly integrated, and they must cross all ages. So it starts from prenatal care right through to ensure if we want to build very healthy communities and it to be sustainable. I think we're a long way from that within our healthcare system overall. But the ideal would be, as we're building language-specific services, we recognize that it needs to cross all of the ages, that we need healthy people across all, from children to youth to adults to seniors, to ensure that everybody has the opportunity for positive health outcomes as they move through the ages. I think it's really important for there to be some type of an education component built into the education for all health services providers to really understand the impact of language and the impact of culture. It's something that, as I've progressed through this journey, that I've seen how significant it is, and we want to have this reinforced, I would believe, right from the beginning, as versus when we come towards the end of life and providing services for seniors, where sometimes the health outcomes could be much more positive than they are. Looking at the model and going back before the actual development of the model, the work we did with Accreditation Canada, when we were a pilot site for testing the draft of the linguistic and cultural standards at that point in time, really was very beneficial to us to look at. So I think that's one of the recommendations that I would make moving forward, that it become a universal concept. I believe with the changes to the accreditation standards and the focus on that it's going to focus healthcare and social services to consider that as they're moving forward in the building of services.